According to decades of mainstream media reports and publications and recent Harvard professors, eating saturated fat is poison and will kill you. Well, I'm committing suicide tonight because this butter looks really good. Oh, yeah. Oh, and look, my friend coconut oil. If I die before this video is over, maybe she was right. But I promise you, I'm not going to die before it's over. Because saturated fat is not poison and it's needed to live. Earlier this week, I made a video about this topic and saying how Professor Karen Michaels from Harvard should put her Harvard clout behind real poisons such as fluoride, mercury, aluminum, and glyphosate instead of busting on our friend coconut oil. In the news stories covering her comments, they said that saturated fat has no known health benefits, and that saturated fat increases risk of coronary artery disease and heart disease and stroke, and that it should be avoided. Well, I want to show you there are plenty of research tonight that refutes those claims and says that you should actually eat saturated fat and cholesterol for health and to decrease cardiovascular risk and cancer risk. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So let's start our search for truth with this American Journal of Clinical Nutrition article that is a meta-analysis looking at 21 studies to determine if there's an association of saturated fat with cardiovascular disease. This study looked at 21 studies covering over 347,000 subjects over a 23-year period to determine if the intake of saturated fat is associated with coronary artery disease, stroke, and cardiovascular disease. And what they found is that there is no significant evidence for concluding that dietary saturated fat is associated with increased risk of coronary heart disease and cardiovascular disease. So here's one study looking at 21 other studies to see, hey, is saturated fat intake, eating our coconut oil and eating our butter associated with increased risk of heart disease and stroke? And this study says no, there's no significant evidence for that. So this would refute what Professor Karen Michaels and the mainstream media have been promoting over the last week or so, saying saturated fat is poison, specifically coconut oil. It would also refute what mainstream media has been promoting for 50 years, saying that cholesterol and saturated fat clogs your arteries and causes you to die of heart attack or stroke. The research isn't showing that. Let's look at another study. So if saturated fat and cholesterol don't clog your arteries and cause heart disease and stroke, what does? Well, here's an article looking at conversion of sugar to fat. And is hepatic de novo lipogenesis leading to metabolic syndrome and associated chronic diseases? So basically they're asking, does the liver's production of new fats or new lipids from sugar cause metabolic syndrome and chronic disease? So the study says one important pathway that may link metabolic disease to sugar consumption is the liver's conversion of that sugar to fat, and that's called de novo lipogenesis. And what they found was if they looked at obese children and they removed the sugar from the diets of those obese children for only 9 days, 9 days was all it took, and they saw a consistent reduction of de novo lipogenesis and liver fat and improved glucose and lipid metabolism. So what did they remove? They didn't remove fat from their diets. They removed sugar from their diets, and removing the sugar decreased the liver fat and the fat production by the kids' bodies and improves their blood sugar and lipid metabolism. So what they said is, although sugar and beverage industries continue to question the scientific evidence, the media continues to poo-poo the science and ignore the science, blatantly ignore the science that's out there and say there's no proof of benefit. Well, there's tons of proof of benefit. but that doesn't make the system money, so they ignore it and pretend that it's never been tested and determined and say that saturated fat and coconut oil are poison. Well, that's wrong. And this study says that evidence-based recommendations should be to limit simple sugars to no more than 5 to 10% of your dietary intake. How much of the average American diet does simple sugars make up? Far more than 5 to 10%. And there's one awesome graph in here I want you to see. Right here on the third page. This graph is showing us a comparison in people with normal insulin levels. Okay, so in people with normal insulin levels that fasted overnight, and one group ate a high-fat, low-carbohydrate diet and then fasted overnight, and they measured their liver's production of fat from carbohydrate. The other group ate low-fat, high-carb, just like the media tells you to, and fasted overnight, and they measured their liver's production of fat from carbohydrate. And look what happens. If we compare them, the low-fat, high-carb, the media's quote-unquote healthy heart diet, the American Heart Association's healthy heart diet for decades, creates more fat from the carbohydrates, whereas the high-fat, low-carb diet creates far less fat. So what's going to cause heart disease? Fat that you consume or sugar that you consume that then becomes fat? I don't know. Let's keep looking. What about cancer? Cancer is the #2 killer in the US and rapidly approaching #1. Well, how do fats and sugars play into cancer risk? Well, here's a study from the journal Nutrition and Metabolism titled, "Is there a role for carbohydrate restriction in the treatment and prevention of cancer?" And let's just look at the abstract here. Evidence has accumulated suggesting that by systematically reducing the amount of dietary carbohydrates, one could suppress or at least delay the emergence of cancer, and that proliferation of already existing tumor cells could be slowed down. Do you hear that? They basically just said that carbohydrates drive tumor growth, and reduction of carbohydrate intake, sugar intake, slows tumor growth. That's huge. How does it do that? Well, 3 ways. One, tumor cells, unlike normal cells, tumor cells depend on steady glucose availability in the blood. So your dietary sugar intake is what the tumor counts on for itself to grow more and more. Okay. Secondly, high insulin and insulin-like growth factors that result from chronic carbohydrate ingestion in the Western diet. Those carbohydrates stimulate insulin and insulin-like growth factor release, and those directly promote tumor proliferation or tumor growth. So again, you eat sugar, that raises your insulin and IGF-1 and grows the tumor. And lastly, ketone bodies that are elevated when insulin and blood sugar are low, so you're eating a high-fat, low-carb diet, that raises your ketone bodies, ketogenic diet perhaps. High ketones have been found to negatively affect proliferation of different tumor cells or not be usable by tumor cells for metabolic demands. So basically, eating ketones and using ketones for energy steals the energy from the tumors. They can't grow and proliferate, but the host can use the ketones for energy. So those are the 3 mechanisms behind reducing carbohydrate load or sugar intake and reducing cancer risk. So again, the mainstream media would have you eat a low-fat, high-carb diet, and what's the #2 killer rapidly gaining on the #1 killer? Cancer rapidly catching up to heart disease. And we've seen that fat, saturated fat, has no evidence showing that it increases risk of heart disease. Here we have evidence that fat helps prevent tumors. Let's keep going. 2018, they looked at diabetics and put them on a high egg diet. What? Why would you put diabetics on a high egg diet? Diabetics are at an increased risk of heart disease and stroke. A high egg diet's going to kill them faster. Or is it? Why don't we study it instead of making assumptions or reading hysterical media articles? Here's a study. They put type 2 diabetics on a high egg diet for 3 months. High egg was defined as 12 eggs a week or more. And they compared that to a low egg diet, which was less than 2 eggs a week. Let's see, after 3 to 12 months, the weight loss was similar between the two groups, and there were no differences between blood sugar levels, lipid levels, so cholesterol, inflammatory levels, or oxidative stress levels. So although the media would have you believe that the high egg diet is going to clog their arteries and kill the diabetics faster, what actually happens is that doesn't occur. The people with prediabetes or type 2 diabetes who consumed the 3-month high egg diet with a 6-month follow-up exhibited no adverse changes in cardiometabolic markers compared to those who consumed the low egg diet. So the authors concluded a healthy diet should include more eggs than recommended typically. Again, there's lots of benefit to eating eggs, cholesterol, and all the fats, except trans fats. Don't eat those. Why? Because those are man-made, and those are in the processed food, low-fat, high-carb foods that the media and the processed food companies want you to eat, which will feed you into the chronic disease categories. So let's wrap this up with one more study or commentary. Saturated fat, it's entitled Saturated Fat Does Not Clog the Arteries. Coronary heart disease is a chronic inflammatory condition which can be effectively reduced by healthy lifestyle interventions. So look at this first paragraph. Coronary artery disease pathogenesis and treatment urgently requires a paradigm shift. These authors are saying, this is the British Journal of Sports Medicine, they're saying, hey, we've got this all wrong. Despite popular belief among doctors and the public, the conceptual model of dietary saturated fat clogging the pipe is just plain wrong. They're correct. No association between saturated fat consumption and all-cause mortality, coronary heart disease mortality or deaths, ischemic stroke, or type 2 diabetes have been found in healthy adults. Boom. Again, this is a 2017 study saying there's been no association found between saturated fat intake and your death from heart disease, stroke, or diabetes. We could stop there, but let's keep going. What they found is that the alpha-linoleic acid, polyphenols, and omega-3s in nuts, olive oil, vegetable oils, and oily fish are what rapidly create a reduction in inflammation and clotting. So we want to eat these things that are demonized by mainstream. They found that the oils, okay, so coconut oil and butter are demonized, right? And eggs too, by the mainstream media. They're poison, they're going to kill you. Well, what they found in the Sydney Diet Heart Study and the Minnesota Coronary Experiment was that if you listen to Dr. Mike or Professor Michael's recommendations and the mainstream media recommendations, and you pull out saturated fat from your diet, well, you have to replace it with something. What does mainstream media tell you to replace it with? Vegetable oils like sunflower oil, safflower oil, canola oil, which is frankenfood. That's not even a real thing. Well, those oils are high in omega-6 fats, and those vegetable oils increase mortality risks despite lowering your LDL and total cholesterol. So these patients had lower total cholesterol and lower LDL after switching to the toxic oils, but died faster. So saturated fat is not the poison. The poison is the man-made canola oils and then safflower, sunflower, high omega-6 oils, because that makes you more inflamed. So wrapping it up here, we want to create lifestyle changes that promote cardiovascular health. So that is eating a Mediterranean paleo type diet with high fats, good saturated fats, good monounsaturated, good omega-6 to omega-3 ratios, no trans fats. Those diets also happen to be low carbohydrate and sufficient protein. In addition to that, we want to exercise at least 22 minutes a week. These study authors found that if you walk briskly, that's all you have to do, 22 minutes a day, not a week, 150 minutes a week, you can increase your lifespan by 3 to 5 years. Okay, so that's 30 minutes a day. And in just 30 minutes a day for a couple months, they're seeing that people's insulin sensitivity is increasing and insulin resistance is decreasing, right? So that would take us back to this chart. Just walking would help you change from the orange guy to the purple guy. If you walk and eat a high-fat, low-carb diet, you're going to get there faster. So let's wrap this up. They conclude, it is time to shift the public health message in the prevention and treatment of heart disease away from measuring cholesterol and away from demonizing saturated fat. Coronary artery disease is a chronic inflammatory disease, and it can be reduced effectively by walking 22 minutes a day and eating real food. And real food is defined by the other studies as high-fat, low-carb, whole food diet. There is no business model or market to help spread this simple yet powerful intervention. And that sentence is very important. Because there's no market, because if you're healthy, you don't make the system money, they're not going to promote this, and they're going to continue to ignore the piles of data that we have telling the truth, which is that coconut oil is not poison, saturated fat is not poison. Sugar is the poison, and sugar and high carbohydrate is what you have to avoid. And then you have to clean up your lifestyle in addition to the diet, walking 22 minutes a day at a brisk pace, having healthy, happy relationships, getting great sleep levels, and on and on. This is the key to preventing coronary artery disease or heart disease, preventing stroke, preventing cancer. So don't buy the media propaganda, buy the truth. And the truth is that high-fat, low-carb diet is the way to be.